Welcome, everyone. Our presentation will begin in just a few minutes. In the meantime, feel free to explore the different resources that are available to you on the platform. All right. Hello, everyone. Thank you so much for joining today's instructor webinar. My name is Brooke Rowe, and I'm the Product Marketing Manager for Shadow Health. Here are a few housekeeping notes before we dive into the presentation. By default, you are muted and your webcam is off in this webinar. Please use the Q&A box to ask any questions you have throughout the presentation. We will also have dedicated time at the end for Q&A. The display in the On24 platform includes resources that we encourage you to explore. Feel free to adjust this display screen to meet your optimal viewing needs. This meeting is being recorded and it will be available to view on demand after today's session. And before you meet our speaker today, we'd like to learn a bit more about you. So you're going to see two poll questions that will appear that we'd like for you to complete. They will appear one at a time. The first poll question is, in which program type do you teach? All right. And then the next question is, which products would you like to learn more about today? Perfect. Lots of interest in advanced primary care mental health. That's a really exciting collection coming up soon. So without further ado, I would like to introduce you to today's presenter, Dr. Cheryl Wilson. And as the Director of Education, Research and Design for Elsevier Shadow Health, Dr. Wilson brings together clinical, educational, and simulation expertise in building realistic, evidence-based virtual patient simulations. Her vast background in practice and in teaching didactic and clinical for undergraduate and graduate advanced practice nursing provides a wide range of clinical and student experiences to build upon. Dr. Wilson has a passion for improving clinical reasoning and diagnostic reasoning while building communication skills. And as an expert in curriculum development and design, she advocates for integration of meaningful simulation experiences at all levels of training, including for new graduates. So Cheryl, I will pass it on to you for the main event.
Thank you so much, Brooke. Good morning, good afternoon, and good evening, wherever you're listening from, and welcome. Like Brooke said, I'm Cheryl Wilson. I'm the Director of Education, Research, and Design at Elsevier Shadow Health, and welcome to our graduate demo webinar. So it's critical for your providers to be practice ready. Today, I'd like to talk about what's interfering with their ability to be as confident and skilled in treating patients as they transition into a new role. And this includes in understanding what you can do to ease pressures and facilitate learning so that your new providers consistently apply best practices to diagnosis and decision making. So let's get started. You're working hard to prepare your new providers to excel in complex and challenging health environment. Yet, as they take on this higher level of responsibility, providers face greater scrutiny over patient outcomes, especially with 12 million patients experiencing a diagnostic error every year. And these patients, 20 to 30% of women and minorities, are more likely to be misdiagnosed. Sadly, 40 to 80,000 patients die annually from complications of misdiagnosis and the failure to identify a condition being the #1 reason for lawsuits. As a result, there is increasing worry and pressure to avoid making any diagnostic errors. On top of this, your new providers may still be reeling from the repercussions of pandemic-related patient conditions, demands, and protocols. More than ever, the pandemic highlighted the growing complexity of both diagnosing and treating patients with comorbidities. Promoting the best possible outcomes for such patients is incredibly critical now that 27% of U.S. adults have multiple chronic conditions. Yet, many providers may lack the confidence to make the complex decisions required to appropriately treat them. Naturally, the sooner your new providers can learn your best practices, the more equipped they'll be to deliver standard of care and interact with patients in a way that demonstrates skill, empathy, and critical thinking. You may be using simulation tools for this purpose, but they don't supply what providers need to strengthen learning and make effective care decisions. For example, pre-populated menus or multiple choice responses don't allow your providers to practice gathering information in their own words. These are more rigid options, and they fail to address diverse populations and promote the use of more inclusive language, both of which aid providers in capturing critical patient information. Current simulation tools may also limit practice in refining diagnostic reasoning. As a result, it's difficult to bring providers with varying amounts of experience up to the same level of critical thinking in a timely way. At the same time, they may lack standard mechanisms. You need to measure new providers' progress against best practices. As it stands today, your providers are at the mercy of the clinical space in terms of the access to direct patient care. They may spend too much time observing their preceptor versus taking care of a patient themselves. Or they may be interacting with the same types of patients. Either way, they're getting limited exposure to diverse patients and medical conditions, including learning how to communicate using an inclusive therapeutic language that's sensitive to patients' cultural and demographic backgrounds. Ultimately, all these limitations interfere with the ability to build provider accuracy. Despite your best intentions, you may find your new providers continue to face learning hurdles in key areas, including patient care best practices, Without more effective tools to promote provider learning, you could keep the academic to practice gap open for some time to come and face related risks. So what if they could safely transform your new provider's practice readiness? We're going to explore how you can employ this approach to help your providers improve clinical reasoning while improving overall diagnostic accuracy through high-fidelity screen-based simulations. Okay, so we're going to get into the demonstration now. So this is an example from our advanced health assessment. And I'm going to go ahead, give me just a moment here to share my screen and get everything pulled up. Okay. Go ahead and get her voice going and okay, great. So we're going to begin our exam here with Tina Jones. So let's find out a little bit about Tina Jones. She is one of our original Shadow Health patients, and she's presenting to the primary care clinic with trouble breathing and a history of using an asthma inhaler. You interact with Tina to practice communication skills via subjective data collection, education and empathy, and documentation. So let's get started. Okay, just to give you a quick orientation, down here at the very bottom of the screen is where we have our conversation box. And this is where we'll have all of our conversation. And I'm going to actually be talking to Tina today. And so I'll click on this microphone and I'm going to use speech to text. Hi, my name is Cheryl. I'll be your nurse taking care of you today.
Hey.
So you see, we get an actual response from Tina. So I'm going to ask her a few questions just to kind of show you some of the information that we have available and how this actually works. So let's find out what brings her in today. What brings you in today?
I came in because I've been having breathing problems, and my inhaler just isn't working the way it normally does.
Okay, so from her response, we want to give this opportunity to provide some empathy to Tina to make her understand, so she understands that we recognize the problem that she's facing. We get a prompt the very first time this happens to walk us through how to provide education or empathy. So we'll click on the empathize and make a statement. I'm sorry to hear you're having trouble breathing. I'll do everything I can to make you more comfortable.
I appreciate you saying that.
Okay, let's continue on and see if we can find out a little bit more information. And when Tina was being developed, the team was very intentional about building in moments to reflect a realistic encounter with a patient. In communicating, we know the information we want to collect from our patients, but it may not always be how the patient interprets what we're asking. So it's sometimes an issue of perception of understanding or from the frame of reference. So let's see an example here. Do you have any allergies?
Yeah, I'm allergic to cat.
Okay, well, I was actually trying to find out if she had any allergies to medications. It's really important that I know that information because we're going to have to probably prescribe something for her. And what I was trying to find out was a medication allergy, but when I asked just a very generic question about allergies, Tina's interpretation was that, yeah, she's allergic to cats. So let's see if we can ask a little bit more specific question here. Do you have any medication allergies?
Yeah, I'm allergic to penicillin.
Okay, That's really important. We needed to know that she was allergic to penicillin, so we make sure that we don't prescribe anything for her that would be contraindicated. Okay, so let's move on. Tina has a great deal of depth and breadth in her history. In fact, as one of our original patients, she has responses for over 250,000 questions. Oh, and Tina is always learning. Along with our other patients, their responses grow based on questions asked. So if learners are asking questions that are not being answered and they're being redirected to ask it in a different way, we actually can have our patients learn those questions so that when they're repeated in the future, she can respond to them and answer. So let's find out if she has any other medical conditions, because we know she said she's here for shortness of breath and her inhaler doesn't seem to be working. It sounds like she probably has asthma, but let's just make sure. Do you have any medical conditions?
Yeah, I've had asthma since I was really little. Plus, I have diabetes.
Okay, so she did verify that she has asthma, and we could continue asking her questions if we wanted to unlock more information. How often do you have an asthma exacerbation? Here's an example of the redirection. I asked, do you have an asthma exacerbation? And it didn't really hear me appropriately. This is what I asked. How often do you have asthma exacerbations?
Maybe as much as every 4 hours? It's a lot.
Okay, and as you see, we keep getting this little green thumbs up over here on the side, which tells us that we're uncovering information appropriate for our encounter. This interview guide over here on the side helps direct us. It shows us that we have discoveries to unlock. Right now, I've already unlocked the show discoveries of the chief complaint. I established that, but I still have additional items that I've not uncovered in the history of present illness and the rest of her history. So we can continue asking questions until we've uncovered all of the information necessary for this focused exam. But we're going to move on and go ahead and do some of her physical examination because I want to highlight the high fidelity examinations. So we're going to move right into the auscultation. And we're going to listen to her breath sounds. And so here we have our stethoscope and our navigation map over here on the side of the screen. And we hover over these dots, and when we click on them, it allows us to hear her lung sounds. I hope a little bit of it's coming through. I'm not sure. Sometimes when I am doing a presentation like this, it doesn't come through as much as I'd like, but I do want to demonstrate this for you. That we can click on all of these and then also turn her around and listen posteriorly. And we can go through each one and listen. I'm going to skip a couple. Oh, that sounds a little different. So we're hearing something different here. And what I want to do is go over here to my electronic health record and document what I just heard. So her breath sounds were present in all areas. She did have some adventitious sounds. I could say those sounded like wheezing to me. And then I need to say, where were those adventitious sounds? All right, so we heard those in her posterior left lower lobe and posterior right lower lobe. So we've gone ahead now and documented what our findings were. This is actually where the scoring takes place for the physical examination. It's not that they've performed the exam, it's that they've documented what their findings are. We could also check for bronchophony if we wanted to. And she's saying 99. So then we can document what our findings are. and move on in her physical exam. We can always also do things like check her spirometer, check her inhaler. Let's make sure that we know what inhaler she has. And so we do get to see the label here, and we notice that it is the Proventil. And so we try to provide as much information as possible. All right. So I'm going to go ahead and exit out of Tina's exam for now, and we're going to move into one of our other patients. I wanted to show you some of our additional primary care patients that include medical decision making. All right. So let's go on here and we're going to resume. Let's get our volume up here so you guys can hear this interaction and also see what's going on. Okay. So this is our sick visit integumentary assignment that is part of our advanced primary care adult product line. This is one of 5 patients, and this is Philip Barbosa. So we land here at a screen after we've gone through our pre-brief, and you're asked to review the chart, which is something in practice that as a nurse practitioner, it makes sense for you to do before you go into a patient's room. You want to see what was their last visit, what were their latest vitals, what information do I need to know before I go in here and start interacting with this patient. So we went ahead and populated that information, as well as giving you an opportunity to see any screening that has taken place. So we did a depression screening and found that he's feeling down, depressed, or hopeless nearly every day, feeling tired or having little energy. And this may play into what's going on with Mr. Barbosa. So we'll go ahead, back to his details. Let's meet him and start our interaction. So we go ahead and enter the room, and again, we can greet our patient. Hi, my name is Cheryl. I'll be your nurse practitioner today.
Hi.
Okay, and so we can ask him how he's feeling today. How are you feeling today?
I have this painful rash on my back.
Okay, again, the first time we encounter one of those moments to provide education or empathy, we get this just-in-time tutorial. We're going to go ahead and empathize. I am sorry to hear you're in pain. I'll do everything I can to make you comfortable.
That's nice of you.
Okay, so we can go ahead and let's find a little bit more about this rash. When did you first notice this rash? He says he started having pain and noticed the rash 2 days ago. All right. Can you describe the rash?
Yeah, the rash is red, has small blisters, and I feel a burning pain.
Where is the rash located?
The rash is on my right lower back. I have pain there too, but it's not radiating.
Okay, so we're finding out a little bit of information, and we can go ahead and document what we're finding so far. But we're going to go ahead and move into the inspection and the look at his actual skin. So we'll go ahead, we're inspecting his chest. We don't see anything there. We're going to turn around a little bit and keep turning him. And here you see this rash that he has described. It looks like, and again, we're going to have to document this. So we assess the rash, and it is on his right side of his back, The dermatomes it's located is one of the thoracic. And we can go ahead and go back and let's do a little bit more of an assessment on the character of the rash. We do get a prompt saying that we put on gloves so that we don't come in direct physical contact with the patient's rash. Because if anybody here is a nurse practitioner, I think most of you are teaching in graduate level programs, you probably know that this is something that could be very contagious. So let's make sure we don't spread that contagion. All right, so we get a little closer look here at the rash, and we can see that we need to document the characteristic of the rash. So it looks clustered. There's some blisters. It's on one side, dermatomal. Okay, that looks good. All right, and so we can go back and we could finish the rest of his examination if we wanted to. What I want to do is I'm going to leave before I do anything else and show you some of the unique activities that we have in our primary care series of patients. So we do give warnings to our learners to let them know that, oh, by the way, you haven't documented everything, you're missing some things. Do you want to go back and maybe get those? Or I'm going to go ahead and leave because I want to show you what else we have to do. So
in your next activity, you will select.
Sorry, Preceptor Diana, we're going to talk over you. So we're going to go ahead and select, this is where that medical decision making comes in. Now the learners still have access to their electronic health record, and if they made notes here that for the subjective and objective, they can take a look at those. So they don't have to just remember everything that just happened in the encounter. They can look back at those notes. And we'll go to the problem selection, and this is where the learners come up with their primary diagnosis. So we provide them some options and see which one of these makes the most sense. And we're going to say this looks like herpes zoster, and we do need to provide some of the evidence that tells us that we say supports this diagnosis. So burning, clustered vesicular lesions. Let's see here. Dermatome. We have two more. It's got, let's see here. He's had chickenpox in the past, and he's had a lot of mental stress. We saw that when we reviewed his depression screening. All right, and here we can say, what's the rationale? Why did you select these? So now this allows faculty not only to see, did they get the right answers or the wrong answers, or what was their thinking? I'm going to say I guessed. Okay, and we do get feedback as to what was correct and what was incorrect. And we can move into, this is just feedback again from our preceptor to say, this is what we're moving forward with for this medical decision making. And now she's going to give us some more instructions to move into the problem selection. And during this problem selection or plan of care, what we want the learners here to do is to think about what are the areas that you need to develop for your actual care treatment plan. So am I going to prescribe something pharmacologic? Yes. Am I going to do something non-pharmacologic? And I'm just going to go through and select all of these, even though I know I'm going to get some of them wrong. And for each of these, you can provide a rationale as to why you said yes or no. Now, I know these are not all correct answers, but I'm just going to select them all. All right, and we do get feedback as to what the right answers were. I should not have done preventive screening. There's no diagnostic tests I need to order. I don't need to refer him right now. So I knew I was going to get those wrong, but I wanted to show you what that looks like. All right, now we can move into the prescribing medications. Oh, and one thing with each of our primary care patients, our team has selected one of the items from the treatment plan that is going to be focused in on. So not everyone will have a medication selection. Some will have an education. Some will have a referral. Some will have ordering diagnostic tests. So we wanted to make sure we included each one of those so you could give an example of what each of those might look like. So we can go and we can select the medications. Once we've selected the medications for the treatment, the pain management, and any adjunctive treatment, then we could move on and finish our assignment. And we'll get our feedback. But I'm going to show you that here in just a second. So let's go ahead and move on to one of our other patients okay. Last one here that we're going to go through. Let's again turn up our volume and go to full screen. All right, this patient comes from our Advanced Primary Care Women's Reproductive Health product. I am going to warn you, we do show sensitive exams, and I am going to demo a breast exam and a pelvic exam. So I do want to just add that as a warning here before we get into this. And this is Melanie Bishop, and Miss Bishop is here today for her Well Woman exam. Let's go ahead and start up. So we've washed our hands, and we can continue. And again, hi, my name is Cheryl. I'll be your nurse practitioner today.
Hey.
What brings you in today? What brings you in today?
I'm here for my regular checkup.
Okay. And one thing I just want to step back for a minute and just kind of talk to you guys about is the different voice talent that we have utilized for each of our patients. These are each created individually, and we use different voice talent for each and every patient to get that realistic interaction and bring that to the learners so that it will match. We do an extensive search to find voice talent that matches what our patient's character should sound like. And then our team brings that to life in the patient so that you aren't just talking to a computer that has the same computer generated voice all the time. It actually is specific to the curated patient and their background. Okay. So let's go ahead and we're going to collect a focus history with an emphasis on breast health, gynecological health, sexual health, and contraception. Perform a physical exam. Again, determine if there's a problem, any diagnostic tests that need to be performed, and develop a treatment plan. So we're going to begin the visit by reviewing her history. And we can go here in the chart on the right-hand side of the screen. We have all of her information. We note that she has a Paragard intrauterine copper contraceptive. She has all of her immunizations. We do notice a family history here. We're going to have to ask her some questions. Her sister was diagnosed stage 1 breast cancer 2 months ago. So we do want to ask her some questions about that. And then we're also going to notice here that she does have a strong network of family and coworkers. We can see her occupation is that she is a police officer. Because this is a sensitive exam, we do want to build some rapport with Miss Bishop and find out a little bit more about her. We can also see her prior notes here. And this was for her annual physical. And when that was performed. And so we can take a look at that and we can review any of her past medical history, take a look at her GYN history. Okay. So as I go ahead and build rapport, one of the things that I want to practice asking questions and getting to know my patient is I want to ask her if it's what her pronouns are. What are your pronouns?
She, her.
Okay. And I also want to go ahead and find out if we have consent today. Do I have your consent to talk?
Yes, you have my consent to ask about anything you need to. I have no problems answering honestly.
Okay. And we're doing a really good job here of building rapport. And so I already asked her what brought her in today. So we're going to go ahead and assess her because she is here for a well woman exam. I want to go ahead and ask her about some of the risk factor items I identified when I was reviewing her chart. Do you have a family history of gynecological cancers?
Well, one of my sisters was recently diagnosed with stage 1 breast cancer. She found out 2 months ago, so she's been through a lot.
This would be a good time to empathize. I am sorry to hear that. It must be very difficult.
That's kind of you.
Okay. So we can go ahead and we can ask her if her sister had breast cancer. Let's see if she's doing any breast exams. Do you perform self-breast exams?
Yes, I recently started doing self-exams. I want to stay on top of breast cancer prevention and be as knowledgeable as I can about it.
Okay. Let's find out if she's felt any lumps. Have you felt any lumps in your breasts?
No, I haven't noticed or felt any lumps.
Okay, so we're getting a really good picture here of Ms. Bishop's health and her own preventative care that she's doing at home, making sure that, she understands her risk factors and is doing everything she can from a preventative manner. So we're going to go ahead and move into the physical exam menu. I did want to bring to your attention, we don't have anything here for our gynecologic exam. And there's a reason for that. These are just general examination items versus the vital signs. Then we can inspect her skin and thyroid. We can listen to heart, lungs, and bowel. We can palpate her abdomen and thyroid, and then also percuss her abdomen. As you notice, there are not any of the gynecologic exams here because we want the learners to make the determination of what items they need to do. So we're going to go ahead and proceed in the assignment. So we're going to determine the list of reproductive exams and tests that we want to perform based on her assessment, based on her needs, because not every patient gets the same thing. So this is a learning moment for students in order to demonstrate that they understand what's appropriate this time. Okay, so we can select the bimanual exam, a breast exam, we're going to do a PAP, let's see what else. We're going to do a pelvic exam. Let's say that's everything. So we can go ahead and submit that. Looks like I got everything correct. Oh boy, I selected bimanual breast cervical. I did not select the HPV test. I did not review that she has not had an HPV test in the last 5 years, and that's something that I should have ordered because that's the standard of care. So here are the items that, according to Diana, my preceptor, she gives me a little redirection and tells me here's what's appropriate. So we'll go ahead and move on. And since we're going to perform reproductive exams, we wanted to let you know that there is going to be a chaperone. Preceptor Diana will be present in the room. We're not going to see her, but she's there. Okay. So we do want to go ahead and let Ms. Bishop know what physical exams we're about to perform. I'm going to perform an examination on your breast, a pelvic exam, and a bimanual exam. And sometimes when I'm using this mode, it does not pick up my voice very well.
Okay, I've had all these exams before, so I know what to expect.
Okay, good. She's a really good patient. Do I have your consent to proceed with this exam?
Yes.
Are you comfortable? Let's try that again. Are you comfortable?
Yep, I'm ready.
Okay, so let's get started then. So because we want to perform the breast inspection first before we palpate, we're going to go ahead and get some instructions to choose from the menu on the top left. And we have the breast inspect. And then we can go ahead and go through each one of the actions to say and document what we're visualizing. Arms at hip. And then arms interlocked. Okay. And we don't see anything abnormal with her skin color. We don't see any dimpling or retraction or anything like pot orange or flattening or anything abnormal with the contour. Areola nipple appearance is symmetrical. So let's move in then. We've now unlocked the ability to palpate her breasts. We lock that so that students don't just jump into the palpation. We want this to be a learning experience where they walk through doing the inspection first and then doing the palpation. So we're going to have her lie down. And we can select whether we want to do the left or the right breast first. Okay. We do get some instruction here that we're using the finger pads, the middle 3 fingers, apply steady pressure, use a circular motion to palpate the breast. We do that in 3 depth levels, superficial, medium, and deep. And also to remember to be symmetric and consistent. And so this is going to just walk right through. It's going to automatically go through and do the breast exam. And you'll see the palpation taking place. You see we've gone through the entire breast, also the axilla. Okay. Now, because I can't actually feel this because it is a screen-based simulation, we do get some instructions that tell us what we felt. It describes that it reveals the breast smooth, non-tender, without masses, no lymphadenopathy, so we can then document what we found. Non-tender. Okay. And we can do that with both breasts. I'm going to move on here. We're going to continue. And it's just a quick reminder, you're not going to be able to return to the breast exam once it's completed. So you have to make your decision now that you've already completed, you know what you've documented, and it's all, you've collected all the information. So now we're going to move into the pelvic exam. And again, we start with performing that visual inspection of external anatomy, then insert the speculum, view the vagina and cervix, and document our findings. So she's due for PAP and HPV, so also collect a cervical cell sample to be sent for testing. If you recall, Ms. Bishop has an IUD, so we should be able to visualize the strings from the IUD also once we insert the speculum. And so we have her get comfortable on the table, her feet are in the stirrups. And now we can insert the learners so that they can see how this goes in and what they're actually looking at. Okay, and you can see the strings of the IUD there as well. You can take a look at, we can see, can document our findings. And We went ahead and collected the PAP and the HPV test. Again, we're not going to be able to return to this. So on the bimanual exam, we're going to go ahead and it'll walk through. We will get the navigation map that shows us where we want to palpate. So we can see that we are palpating, and we get the results as well. Reveal cervix midline, smooth, firm, evenly rounded, mobile without tenderness, uterus palpate midline, and then non-palpable adnexa, non-tender. And so once we finish with that, we can exit and we can go ahead and document our findings. Okay. And again, here we have a final check before we leave to make sure that we've documented everything that we want to document. We can leave the room.
In your next activity, you will determine an appropriate plan of care for.
And we can go ahead and determine what our plan of care is going to be. And again, here we can select pharmacologic, non-pharmacologic, the same activity that we had before. Okay, so I did want to show one last thing before we finish with the demonstration. And that is going through and seeing what the results page looks like. So when a learner finishes with their examination and they've finished with the entire activity, this is a screen that they will end up with. And this is with Philippe Barbosa. And so what it shows here is we have our student performance index, which shows how many of the items were uncovered, how well they did in the examination. Are they in a beginning stage? Are they developing, or are they proficient with their examination? I did not do very well because I only collected 3 out of 37 subjective data items. 2 of the objective. I did pretty good on the treatment plan though, because I got 37 out of 40 on there. And then we have a weighted score against a norm score against a national average. And so this 42 out of 91 would actually be more of like a 56.2%. I didn't do very well. But as faculty, a couple things that you want to take a look at is if you have students that are doing poorly, and even the learners can look at this, they can see like, what items did I struggle with? And so they can take a look at the subjective data collection and they can say, ask about location of symptoms. I didn't ask the location. So when I went through, this is a different attempt. I did ask it earlier. Here is a pro tip and an example question. So the learners can actually go through this, and if they didn't ask them, they can learn how to ask these questions so they know how to do this next time they go through. Same thing with education empathy. They can see, what did I encounter and what did I follow up on? So I encountered this, but I didn't follow up on it. And we can take a look at the documentation and we can see where our documentation is. They are provided with model documentation so I didn't document anything. So I'm a very bad student. So you can take a look at what you document as a student versus the model documentation. And faculty can look at this as well to see where are the areas that my learners need the most help. What is it that they're not getting? Are they not documenting appropriately? Do they need some remediation in that? Are they having trouble with collecting the data? Are they having trouble documenting? So it provides you with an insight into that if you have students who are struggling. Okay, so I'm going to go ahead and stop sharing my screen right now. Okay, and go back to, I just wanted to say that I presented these 3 patients, one from each of our products, but of course, you know, we have a lot more products, and if I had more time, I would love to have presented more. All right. I think I left enough time for questions, Brooke.
Yes, you did. So Cheryl, thank you so much for that fantastic presentation. And now we're going to move into the Q&A portion of the webinar. We've received some questions during the presentation and before, so we can start with those. And then, of course, if you have any questions, you can enter that into the Q&A box on your screen and it will pop up for us. So Cheryl, the first question is, how long do the simulations in Shadow Health take to complete?
Great question. So it depends on the product. Most of our interactions that are from the advanced primary care will take anywhere from 60 minutes to 75 minutes. In our advanced health assessment, sometimes they take a little bit longer because that's usually the first time the students have encountered the patients and they're digging a little deeper so that it's a more comprehensive assessment. Things like our health history can take 75 minutes to 90 minutes because it's a lot longer and more in depth. There's more items for them to uncover. We do provide that as part of our one-pagers. It gives you a little bit of an example for each one of the cases. It does give you an estimate of how long it should take for each one of the assignments.
Thank you. All right, and then our next question, something very top of mind right now. Does Shadow Health align with AACN's new essentials?
Oh, great question. Yes, it does. We have mappings available to the domains for the products that have been released, and we are working on a deeper dive on those alignments down to the sub-competencies, but we do have alignment with the new essentials. That is very timely. Thank you.
Thank you, Cheryl. And what are the products that we didn't get to see today?
Oh my goodness. So we have really great, exciting products. So we have our advanced pathophysiology, advanced pharmacology patients, where you're actually practicing prescribing medications and writing the prescriptions and providing the education. We also have advanced diagnostics where you should be practicing the diagnostic process. We actually have an introduction patient there where we walk you through the decision-making process or medical decision-making process, and then practice going through that with additional patients of how do you come up with a diagnosis. And then we have in our advanced primary care series, we have the advanced primary care adult, which we showed you, advanced primary care women's health, which I showed you one patient. We also have advanced primary care pediatrics, and soon to be coming out is our advanced primary care mental health, which is we're working on right now and will be released out into the market very soon. So that's our suite of graduate products right now. Did I miss anything, Brooke? Keep me honest here.
You got them. Thank you. All right, we see some questions coming into the chat. Thank you so much. We have how many different patients or diagnoses are included in this DCE? So I think we can look at Cheryl, women's reproductive health, and then we can expand on others if needed.
Yeah, so in our women's reproductive health, we have 5 patients. And so we have a patient that comes in for contraceptive care. We have a sick visit with abnormal uterine bleeding. We have our well woman exam. We then have a problem visit with menopause where you need to address signs and symptoms of menopause and what to do that's appropriate. And then we have a sick visit pregnancy complication, which is really interesting because we have a pregnant patient that comes into primary care and actually needs to be emergently transferred to the hospital. She has a DVT and is going to need some further care that's outside what you can do in a primary care office. So that's just an example from the women's health. And we have a minimum of 5 patients in the pediatric and in the adult as well. So each patient has a unique diagnosis or problem.
Thank you. All right. Next question is, how does Shadow Health incorporate principles of DE and I?
Oh, well, the diversity, equity, and inclusion, great question. As you can see, just from our women's reproductive health, we have a very diverse group of patients. I'm going to show you, these are the patients from our adult. You know, we really take care when we go into the initial research of what are our patient cases going to be? What patients do we want to include? And we work very closely as nurse educators and a group of learning designers with narrative designers who actually create the patient narrative. We work very closely with them to ensure that we have representation across cultures, religions, backgrounds, ethnicities. And then once we have decided on a patient, we reach out to experts in that area in order to develop patients appropriately. We use cultural expertise and subject matter experts, not only in healthcare, but also with those backgrounds that they can help us out with. So for instance, we have in our advanced farm, we have a transgender patient, and we have worked with Trans Equity Council to ensure that we have appropriate representation of how our patient would interact with a provider. So we have made that a top priority to ensure that we do have a very diverse group of patient interactions from all economic backgrounds, all cultural backgrounds, ethnic backgrounds, racial. I mean, it's just, we really take care to ensure those are included, as well as that they are appropriate representations.
Very, very important. Thank you, Cheryl. Okay, and then moving on to usage in courses. So we have a question that came in. How would this be used in the classroom?
Well, that's a great question. I always love this. Having taught at the graduate level in the past, it's one of the things I absolutely love talking about. So there's a couple ways you can use this. And when you think about using in the classroom, this is an assignment that you can use to deepen a student's understanding of content that you covered, and then bring it back into the classroom and go through the assignment with them after they've all completed it. Talk about those important moments where they uncovered information and help them to connect the dots. You should be able to help your learners be able to see, like, why was it important to ask questions about this from their background, or do this risk assessment. Talk about the other differential diagnoses. Why wasn't it this other differential? What were the signs and symptoms that align? So you can really start to not only use it as something to give them the clinical experience, but also bring it back into a classroom to really break it down and talk about this patient. Because the one thing that this has is every student that goes through the assignment, they all have a similar patient experience. Because it is a standardized experience. So when you send them out to clinical, everybody has a different patient they take care of. You don't have anything that they've all had a similar experience with. So you can start to bring that in and talk about it and design activities in your classroom to actually bring these to life.
Perfect. Thank you so much, Cheryl. All right, so we're just at time here, so I think we can wrap it up. So thank you so much to everyone who joined us here today. That is all the time that we have for today's event, and we will follow up on any questions that we did not get to during the presentation itself today. And a huge thank you again to our presenter, Dr. Cheryl Wilson. Cheryl, for you sharing your expertise and insights on how high fidelity simulations can improve clinical reasoning and build communication skills. Everyone who registered for this event will receive an email with the recording, and we hope you all have a great day, and thank you so much again.